Hey guys, it's Dr. Horzempa, and I wanted to talk today about personalized medicine. So, personalized medicine has become a catchphrase, certainly in the alternative medicine world, and now even in the conventional medicine world. And certainly, it's you see it everywhere. I have it on my website, but I get questions from people about, well, what does that mean? And so I realize that there's really no formal definition of personalized medicine, although many people have tried to define it. But I think the best way I know how to define it is by example. So I'm going to give an example of my average kind of patient encounter day and workflow being just a conventional primary care doctor versus what I do now in my private practice. So when I was doing primary care, I would see from 30 up to maybe 50 or more patients a day. 5 to 10 minute visits usually. And generally, what would happen is I would see the patient, I would come up with an idea of what I think is going on with them, and then we would try to implement something to help it. Now, most of the time, because of time limitations, this something to help it usually was a pharmacologic agent, a medication. Although I would try to talk here and there about diet and lifestyle and sleep and all these things, the reality is with 5 or 10 minutes, that's kind of what you get. And what you're getting with a medication is this is something that has been studied in large groups of people. It is something that has some evidence to treat this condition. So we're not talking about giving something that's going to be completely useless, but since most of the diseases we see in primary care are chronic diseases, and most chronic diseases are lifestyle driven, medications don't tend to address the root causes of these diseases, so tend to end up being band-aids. Many people have said this before. I don't think I'm saying anything new. So going back to that encounter, I would see the patient, come up with an idea of what I think is going on, prescribe a medication, or maybe, if we really had a motivated patient, talk a little bit about diet and give a handout on that, and then go on to my next patient. Now, the research that I would do with a continuing medical education, I guess is a better term for that I would do was what is required for my board specialties, and it usually involved reading, journals that were family medicine journals. So now contrast that to today. I generally spend 60 to 90 minutes with a patient. We dig in very deeply to the lifestyle and how they're sleeping, how they're eating, how they're moving, toxins in the environment, all these things. And then they get a custom lifestyle plan from me that takes into account all of these lifestyle factors. So they get a diet, they get an exercise plan or training regimen, they get recommendations on how to sleep better, all these things. And then the other thing that happens is, while I'm still reading these family medicine journals, and I think they're useful, oftentimes clinical questions are coming up within the patient encounter. And someone's asking about something in respect to treating their disease. And then what would happen in a typical primary care environment is I would give my best guess based on what I know from all my medical knowledge. Can this thing help them? And that would probably be the end of it. What happens now, which really gets to the core of this definition of personalized medicine, is when that clinical question comes up, I spend time digging into the scientific literature to find an answer. And I think that really is, like I said, the heart of personalized medicine, because I'm seeing a person in front of me who I'm doing individual research on. And some of that individual research is a good medical history, learning about the way they eat, the way they move, their relationships. But also I'm doing research on a very, very individualized clinical question that has to do with that patient. And then once that research is done, a recommendation is made. And the key here is it may not be the same recommendation that I would have made off the top of my head prior to doing the research. So this is where I really think personalized medicine becomes so useful. And this is my definition of it. And this is how I approach it in my current primary integrative medicine, primary care practice. So I hope this has been helpful in hopefully illustrating this question and at least helping people understand what I mean when I say personalized medicine. So have a great day.